You go to your doctor for a routine checkup, and they order a bone density scan. A few days later, you receive terrifying news. Your bones are thinning. You are diagnosed with osteopenia, or perhaps full-blown osteoporosis. The doctor hands you a prescription for heavy calcium supplements and tells you to drink more milk. For the next 5 years, you follow their exact instructions. You swallow large, chalky calcium pills every single morning, absolutely convinced that you are rebuilding your skeleton. But then, the unthinkable happens. You step off a curb, or you simply sneeze violently, and a blinding, agonizing pain explodes in the center of your back. You go to the emergency room, and the X-ray reveals that a bone in your spine has completely crushed and collapsed. If this is your reality, you feel betrayed. You ask yourself, how did my spine break if I have been taking calcium every day for 5 years? If you are living this nightmare, you must listen very closely. You are the victim of a massive misunderstanding of human biology. Swallowing raw calcium does not equal building new bone. Today, we will explain exactly why your supplements failed, how your bones actually repair themselves, and how we fix a spine that is actively crumbling. To understand why your spine collapsed despite the supplements, you must understand the microscopic engineering of the human skeleton. Most people think of their bones as dead, dry structural pillars, like the wooden beams of a house. This is completely false. Your skeleton is highly active, living tissue. Every single second of your life, your body is simultaneously destroying old, damaged bone tissue and replacing it with brand new, healthy bone tissue. This process relies on 2 highly specific types of microscopic workers. The first group of workers are called osteoclasts. Their job is to break down and remove the old, weak bone. Think of them as the demolition crew. The second group of workers are called osteoblasts. Their job is to pour new bone matrix and rebuild the structure. Think of them as the construction crew. In a healthy 30-year-old, the demolition crew and the construction crew work in perfect, absolute balance. But as we age, specifically in women after menopause due to the rapid drop in estrogen, this communication system crashes. The demolition crew begins working overtime, destroying massive amounts of bone. Meanwhile, the construction crew goes on strike. They stop building. This imbalance is the true definition of osteoporosis. The thick internal honeycomb of your spinal bones becomes hollow, paper-thin, and incredibly fragile. This biological reality exposes the catastrophic flaw in the calcium myth. When a general practitioner tells you to just take calcium pills to fix your osteoporosis, they are ignoring the microscopic workers. Calcium is simply the raw material. It is the brick and the mortar. Imagine you are trying to build a brick wall. If your construction workers are on strike, it does not matter if a truck dumps 10,000 premium bricks onto the job site. The wall will never be built. The bricks will just sit there in a useless pile. This is exactly what happens when you swallow massive doses of calcium while you have active osteoporosis. Because your bone-building cells are deactivated, your body has zero capacity to absorb that extra calcium and physically weave it into the architecture of your spine. You cannot force a bone to grow simply by flooding the stomach with raw minerals. This creates a very dangerous secondary problem. If you are swallowing massive doses of calcium, but your bones refuse to absorb it, that heavy mineral has to go somewhere. The unused calcium continues to circulate in your bloodstream. Over time, it searches for somewhere to land, and it frequently settles into the soft tissues of your body. Medical studies have shown that excessive, unabsorbed calcium supplementation can lead to severe calcification of the blood vessels. The raw calcium literally hardens inside the walls of your arteries, making them stiff and dramatically increasing your risk of cardiovascular disease. It can also crystallize in your kidneys, forming agonizing kidney stones. You are actively endangering your internal organs to supply building materials to a construction site that has been completely shut down. We cannot fix this biological failure by guessing. We must act as elite medical detectives to map exactly how fragile your spine has become. A general doctor will order a DEXA scan, which gives a T-score to measure your overall bone density. A DEXA scan is an excellent early warning radar, but it is completely useless for diagnosing an active spinal emergency. If you have severe, sudden back pain, an elite neurosurgeon demands a high-definition magnetic resonance imaging scan. We explicitly use a fluid-sensitive MRI sequence called STIR. We are not just looking at the shape of the bone, we are hunting for active internal fractures. Because osteoporotic bones are completely hollow, they do not just snap in half, they pancake and crush inward. This is called a compression fracture. On the STIR sequence MRI, a freshly crushed bone will bleed internally and swell. This bone marrow edema glows like a bright white fire on the dark screen. If we see that bright white signal, we have undeniable objective proof that the architectural integrity of your spine is actively failing at that exact millimeter. Because this condition involves both a biological failure and a mechanical collapse, our treatment protocol is strictly divided into two phases. Phase 1 is biological rescue. To actually rebuild the bone, we must fire the demolition crew and wake up the construction workers. We work with specialized endocrinologists to deploy advanced biologic medications such as bisphosphonates or monoclonal antibodies. These are highly engineered drugs that physically command the bone-destroying cells to stop, allowing your skeleton to naturally regain its density over several years. But if your spine has already suffered a massive compression fracture, biological medicine is too slow. We must initiate Phase 2, mechanical rescue. If you are in agonizing pain from a crushed vertebra, we do not force you to lie in bed for 3 months in a plastic brace. We use an advanced, ultra-minimally invasive surgical technique called kyphoplasty. Under live X-ray guidance, we guide a tiny hollow needle directly into the center of the crushed bone. We inflate a specialized medical balloon to physically push the collapsed bone back up to its normal height. Then, we inject a highly specialized medical-grade bone cement. This cement hardens in 15 minutes, becoming infinitely stronger than your natural bone. The structural collapse is instantly halted, the spine is internally casted, and the agonizing pain usually vanishes the moment the patient wakes up. Many older patients accept the agonizing pain of a crumbling spine because they believe it is just an inevitable part of aging. They rely on useless, over-the-counter supplements and resign themselves to a life of limited mobility. But let us look at the true cost of accepting this myth. If you ignore a spinal compression fracture, the spine will permanently heal in a crushed, forward-leaning position. This creates a severe hunchback deformity known as kyphosis. This unnatural curve forces your upper body weight aggressively forward, which will inevitably crush and fracture the spinal bones immediately above and below it. It is a catastrophic domino effect. Eventually, your chest cavity will compress so severely that your lungs can no longer fully expand, and your internal organs will be crushed. You are risking a permanent wheelchair and severe respiratory failure because you trusted a calcium pill to do the job of a neurosurgeon. For a fraction of the cost of years of useless supplements, you can have an expert evaluate your skeletal mechanics and stop the collapse instantly. If this video helped you understand your body, please click subscribe. It allows us to keep providing free, elite medical education to patients worldwide who cannot afford a neurosurgeon. You are watching this video because you are looking for a real solution, but you cannot rebuild a collapsing spine by guessing, and you cannot fix a broken bone by asking questions in a comment section. If you have been diagnosed with osteoporosis or you have suffered sudden back pain, do not wait for the domino effect. Every spine is unique. Click the link in the description to upload your MRI or CT scans to our secure portal. Our neurosurgeons will personally review your imaging, hunt for the glowing signs of hidden bone fractures, and build your personalized, minimally invasive treatment plan. Stop living in fear of your diagnosis and stop relying on myths. Let us find your solution today.